Over 100 people die every day to fentanyl overdoses in our country. What if I told you that criminalizing the drug use in America is only making this problem worse? The fentanyl epidemic isn't just a news headline anymore. It's affecting our families, our communities, and our neighborhoods. You or someone you know could be affected next. As someone who's extensively researched this problem, I've seen how alternative solutions like harm reduction could end this deadly problem. The debate around drug decriminalization in the U.S. hinges on whether we can continue to treat this problem as a crime problem or if we start to treat it as a health issue, prioritizing saving lives and getting these deadly drugs off the street. Today I will explore why harm reduction could be the key to ending the fentanyl crisis, why critics argue that it enables drug use, and what ethical dilemmas could arise. Criminalizing drug possession in the U.S. hasn't ended drug use. It's only pushed these users into hiding, making it harder to provide life-saving things like Narcan to them. In states where harsh drug laws are in place, people using drugs are often too scared to go for help. This isolation often increases the risk of overdosing alone. The fentanyl crisis has escalated because of these potent drugs are being mixed into street drugs like weed, cocaine, ecstasy, and most importantly, opioids. Incarcerating these drug users costs the U.S. billions of dollars annually. So us taxpayers are paying billions of dollars every year to keep these drug users in prison. But what if we approach this crisis differently? If the crisis continues unchecked, the number of overdoses will keep climbing and affecting more communities and straining our healthcare and legal systems. Harm reduction is a better alternative. Harm reduction focuses on minimizing the risk associated with drug users, trying to minimize the amount of overdoses and fatalities that we're losing every day. This involves things like giving users clean needles, which can reduce the risk of diseases like hepatitis C and HIV. It also involves getting these users to places where they're encouraged to better their problems and get off the substances they're on instead of being prosecuted for these things and treating them like a crime. In Vancouver, Canada, safe injection sites have reduced overdose deaths and linked people to addiction services. If similar harm reduction programs were implemented widely in the U.S., it could curb fentanyl fatalities by ensuring users have access to life-saving interventions, such as things like Narcan. Studies show that needle exchange programs and overdose prevention sites reduce the transmission of disease like HIV or hepatitis C. By focusing on harm reduction, we can create a safer environment that keeps people alive and offers hope instead of leaving them to die in isolation.